All right. Good evening, everyone. And again, welcome to the latest installment in the Animal Health Education Series through the University of Minnesota. I'm Dr. Maria Granello, and I'll be presenting tonight about colic surgery and the recovery in horses. So first, I'd like to introduce myself to you all. I'm a lifelong horse lover from Dallas, Texas, and I started taking horseback riding lessons when I was 8 years old. I showed my mare an off-the-track thoroughbred named Gertrude through high school and was part of the varsity equestrian team during my undergraduate studies at Sewanee, the University of the South. After college, I returned to Texas to attend veterinary school at Texas A&M University. After graduation, I completed a year-long internship at a referral practice in Denver, Colorado, and then a second internship at Kansas State University, both focused solely on equine medicine. I then came here to the University of Minnesota for a residency in large animal surgery. While I enjoy all facets of equine medicine and care, I have a special interest in emergency care and colic. So now for our order of events for the evening. First, I'll discuss what colic is in horses and what can cause it. We will review the medical and surgical treatment of colic, and then dive into post-operative care after colic surgery and potential complications that can occur. We will also discuss the at-home care needed as horses recover from colic surgery. And finally, I'll briefly discuss an ongoing research project that myself and Dr. Jenna Young are doing here at the University of Minnesota with the hope to improve care for horses after colic surgery. So without any further ado, let's get started. What is colic? It's actually the most common medical emergency that occurs in horses. However, colic can really be a broad range of problems. It just means abdominal pain. Colic does not tell us the why of the problem. And colic can present in many different ways. Some examples of colic signs include laying down, rolling, or thrashing, like seen in the top picture on the slide. However, colic signs can also be much more subtle and may include pawing, looking back at the flank, kicking at the belly, or a decrease in appetite. Horses might also stretch out like they have to urinate, like in the picture on the bottom of the slide, but this is actually most commonly due to abdominal pain. Horses often have a decreased appetite when they're experiencing a colic episode, and they may not even want a favorite treat. Also, while horses may not pass manure during a colic episode, they can continue to have normal manure production. This does not rule out colic. If your horse is experiencing a colic episode, I recommend you call your veterinarian right away, as it is a medical emergency. When a veterinarian evaluates a horse that is colicking, they'll likely perform multiple procedures. We always start with a thorough physical exam to assess your horse's overall health status and their stability. This can also give us clues as to the severity of the colic episode. Sedation, such as xylazine, is often given to calm your horse and provide analgesia or pain relief while the veterinarian completes these procedures during the colic exam. Nasogastric intubation is usually performed as horses can't throw up, so placing a tube through their nose into their stomach, as seen in the picture on the right, or on the left, excuse me, allows any excess fluid to be removed from the stomach. The nasogastric tube can also be used to give oral fluids like water and electrolytes if that's indicated for the horse. A rectal palpation is usually also performed. This allows us to better evaluate for abnormalities within the horse's abdomen. We can detect things like gas distension or an impaction in their colon. An abdominal ultrasound can also be performed to get a better idea of what is happening within the abdomen. It can show us things like intestinal distension or increased free abdominal fluid. Because horses are so large, there's not one good way to get a total look at what is happening in their abdomen. We use rectal palpation along with abdominal ultrasound to gather as much information as possible. Blood work might also be run to evaluate your horse's hydration status, their systemic health, and things like kidney and liver function. An abdominocentesis, commonly called a belly tap, might also be performed, as is seen on the picture on the right. This is a procedure that collects a small amount of abdominal fluid, which then can be analyzed for signs of inflammation or infection. All of these tests and exams together help veterinarians determine a suspected cause of a colic episode and direct our treatment strategy or recommendations for the horse. The vast majority of colic episodes, well over 80% of them, will resolve with medical therapy and treatment. Medical treatment of colic consists of multiple different facets. Fluid therapy is used to keep horses hydrated and encourage gastrointestinal motility. Fluids can be given via an IV catheter or orally through a nasogastric tube. Electrolytes can be added to the fluids if there were abnormalities found on their blood work or to help draw fluid into the intestinal tract. Pain control is also a very important part of the medical management of colic. Banamine, or flunixin-meglumine, is a non-steroidal anti-inflammatory drug that is very commonly given to treat pain associated with a colic episode. However, you should always check with your veterinarian before giving Banamine, as it is a prescription drug and can have significant side effects. Again, the vast majority of colic episodes resolve with medical treatment, including causes like gas colic, which is the most common cause of colic overall, impactions, or displacements. We will discuss what these types of colics are more in the coming slides. While most colic episodes do resolve with medical therapy, a subset of cases, somewhere around 10% of them, need surgery to be resolved. In medical terms, colic surgery is called an exploratory laparotomy, and the surgery is indeed exploratory in nature. While we do our best with diagnostics before surgery, we don't truly know what the problem causing colic is until we actually explore the abdomen during surgery. For colic surgery, the horse is given pain medications and antibiotics before surgery, and then induced under general anesthesia. A team of board-certified veterinary anesthesiologists supervise all anesthesia that is performed here at the University of Minnesota. The horse is placed on its back, or in technical terms, in dorsal recumbency, as shown in the bottom picture. After clipping the abdomen and a sterile preparation, the incision for colic surgery is made on ventral midline, or the exact middle of the horse's abdomen, starting at their umbilicus, or their belly button, and extending usually somewhere around 30 centimeters, as shown in the picture on the right. Once the horse is in colic surgery, the entire gastrointestinal tract within the abdomen is explored to identify and correct any problems. Briefly, let's review the anatomy of the gastrointestinal tract in the horse. After the horse chews and swallows feed, it passes down the esophagus and then into the stomach. From the stomach onwards is located within the abdomen of the horse. From the stomach, food passes into the small intestine, which consists of 3 parts: the duodenum first, then the jejunum, and finally the ileum. The small intestine in a horse can be over 70 feet long. From the small intestine, feed enters the cecum, which is equivalent in humans to the appendix. However, it is much larger in the horse and is important in the digestion of carbohydrates. From the cecum, feed enters the large intestine, which also has multiple sections. The equine large intestine makes a double horseshoe shape in the abdomen and is composed of the right ventral, left dorsal, and right dorsal segments of the large colon. From there, feed enters the transverse colon and then passes to the small colon and out of the rectum as fecal balls. Phew, that's a long way. After reviewing the complex anatomy of the horse's gastrointestinal tract, it should be understandable why it can be so difficult to diagnose the exact cause of colic without surgery, and why so many different problems can cause colic. During colic surgery, about 75% of the gastrointestinal tract can be exteriorized or taken out of the abdomen and visualized. The remainder of the GI tract can be palpated within the abdomen, but it can't be visualized or exteriorized onto the surgical field. Now that we've reviewed the relevant anatomy of the gastrointestinal tract in the horse, I'll discuss some causes of colic that do require surgery to correct. Strangulating lesions cut off blood supply to a section of the intestine and need surgery to correct. There are many different causes of strangulating lesions, and while they can affect any segment of the gastrointestinal tract, they most commonly affect the small intestine. The picture on the slide shows a strangulated portion of small intestine next to a normal section. You can see that the strangulated portion is dark purple and thickened, indicating that that portion of intestine has lost blood flow and will need to be removed surgically. Intestine can become strangulated within a matter of hours from when a colic episode begins, and early treatment and surgery is very important for a good outcome. Some causes of strangulating lesions include a lipoma, which is a fatty tumor that grows on a stalk and can wrap around the intestine to cut off blood supply, a mesenteric rent, or a hole that intestines can get trapped in, a volvulus, or a twist at the base of the intestines, and also different entrapments, such as epiploic foramen or gastrosplenic entrapments, where a segment of intestine gets stuck and loses blood supply within a space inside the abdomen. A volvulus or twist in the intestines can also affect the large colon and can be one of the most painful colic lesions. Again, all of these causes need surgery to be resolved, and the sooner they are fixed surgically, the better the prognosis the horse has. This is why colic surgery is often emergent and must be done immediately, even if it's in the middle of the night. The number one reason to take a horse to surgery is unrelenting or persisting pain that we cannot control with medical management. We are staffed 24/7 here at the University of Minnesota and always available for emergency situations to evaluate your horse for colic or to take your horse to surgery if needed to treat them. After a strangulating lesion has been untangled, if the affected segment of intestine was compromised, a resection and anastomosis is performed during surgery. This procedure involves resecting or removing the damaged portion of intestine and then connecting or anastomosing the two healthy ends back together. An anastomosis connecting two pieces of jejunum, or the small intestine, is pictured on the slide. Connecting pieces within the same part of the intestine generally has the most simple fix. However, sometimes horses have lesions that require a more complicated procedure that involves connecting the jejunum to the cecum or bypassing the cecum altogether. The large colon can also undergo resection and anastomosis. As a whole, the more complicated the rerouting of the intestines during surgery, the more likely it is that the horse will experience a complication afterwards. But before we talk about complications, we'll discuss a couple other types of lesions or problems that need colic surgery to be resolved. While strangulations most commonly affect the small intestine, except for the large colon volvulus that we just talked about, the large colon can also have other types of problems that can require colic surgery. Like we discussed previously, the equine large colon has a double horseshoe shape. However, it is only attached at one point in the abdomen, and the rest of it, as you can see in the picture of the right, is free to move around. This makes it possible for the large colon to become displaced or stuck in the wrong position. This can happen either on the right or the left side of the abdomen. Some large colon displacements will resolve with medical therapy, while some horses do not improve with medical treatment and require surgery where we physically move the large colon back into the correct position. Unfortunately, it can sometimes be really difficult to predict which horses will respond to medical therapy and which will need surgery. Generally, we attempt to manage the horse's pain, and if they continue to exhibit colic signs or the colic signs worsen in the face of medical management, surgery is recommended. Impactions can also occur in multiple places in the gastrointestinal tract, most commonly in the large colon. Again, some impactions can be resolved with medical therapy and fluids, but some need surgery to be corrected. In the image on the slide, the large colon is placed onto an enterotomy tray, and an incision will be made into the pelvic flexure, which is the portion furthest down the tray, and warm water will be used to flush out any impacted feed material. Impactions of other sections of the GI tract, like the cecum or small colon, can also be treated in a similar manner. After colic surgery, the first hurdle for a horse is recovery from anesthesia, and this is also the highest risk time for horses. Unlike people, horses are not designed to stay laying down or recumbent for long periods of time, and they need to stand up within about an hour of surgery to prevent complications like muscle or nerve damage because of their very large size. Additionally, horses are often weak after colic surgery, especially if they've been colicking for a long period of time beforehand. There are many different systems used to assist horses in recovery, and here at the U, we use head and tail ropes to assist the horse in standing, as seen on the slides. While we cannot lift the horse, we provide balance and stability as they rise. Again, board-certified veterinary anesthesiologists monitor and oversee every single case. After the horse successfully stands, they stay in the recovery box for around 20 or 30 minutes to gain strength before walking back to their stall in our intensive care unit. Worldwide anesthetic mortality rates for colic patients have substantially improved in recent years, from 11.7% mortality in 2002 down to 3.4% in 2021. This rate is higher than the overall anesthetic mortality rate for all horses undergoing anesthesia at 1%, due to all of the previously mentioned reasons. Here at the University of Minnesota, over the last 2 years, our anesthetic mortality rate for colic surgery patients is 2.9%, which is even lower than the published worldwide average. Once the horse is back in its stall in our intensive care unit, they are monitored very carefully around the clock by both veterinarians and veterinary technicians here at the U. It is normal for horses to be on multiple medications for the first few days after surgery. Horses are kept on IV antibiotics and pain medications initially, and they are also supported with IV fluid therapy. Depending on the case, additional medications or treatments may be added as well. These medications are usually gradually weaned down over around 5 days. During this same time, feed is slowly and gradually reintroduced to the horse. The average length of post-operative hospitalization for a patient with no complications after colic surgery is around 5 to 7 days. And horses are only discharged once they're off all IV medications and are back to eating a normal diet. Unfortunately, around 30% of horses who undergo colic surgery experience at least one complication. Experiencing an additional colic episode after colic surgery is the most common complication that is experienced in these horses. And some studies have found this to occur in between 28 and 32% of horses. Ileus is another common complication that can present very similarly to colic, and it means that the gastrointestinal tract is not moving in a normal and coordinated manner. Both conditions are usually treated with medical therapy that is very similar to that of an independent colic episode, meaning pain medications and fluid therapy are mainstays of treatment. Horses with ileus often have gastric reflux and need a nasogastric tube in place for a period of time as well. The majority of these complications can be managed medically, but some horses continue to colic and do not improve in the face of medical therapy. Occasionally, in about 6% of cases, according to scientific literature, a horse will need a second colic surgery to correct a problem. Performing a second colic surgery is always a difficult decision for both the veterinarian and the owner, but sometimes it is needed and horses can still have a positive outcome. Horses can also develop complications related to the colic incision itself. The picture on the right shows an incisional infection. Incisional infections are usually treated by opening the skin incision to allow it to drain, and sometimes antibiotics are prescribed as well. An infection also increases the likelihood of an incisional hernia developing. An incisional hernia is a gap that occurs in the body wall at some point along the incision. These hernias are sometimes only cosmetic, and they can be repaired surgically, but usually repair is not recommended until at least 3 months after colic surgery to give the tissue time to fibrose or scar down. Complications related to endotoxemia can also occur after colic surgery. Endotoxemia occurs when a portion of bacteria cell wall enters the bloodstream, and it can cause symptoms like a fever, an increased heart rate, and can also predispose horses to developing laminitis. Endotoxemia is treated with a variety of medications like IV fluid therapy and a drug called polymyxin B that binds to the bacteria cell wall protein. And ice boots are often applied to do our best to prevent laminitis from occurring in the horse. I'll also briefly talk about adhesions, which are another potential complication. Adhesions can form between different organs within the abdomen after surgery due to the trauma and manipulation that occurs during a colic surgery. These may or may not become a problem, but they can cause repeated colic episodes in some cases. If adhesions are causing colic episodes, they can be treated by performing a second surgery where they are manually broken down. The list of potential complications after colic surgery is long, and it also includes other things, but most of them are treatable, and many horses that have a minor complication after surgery still continue on to have a complete recovery. Speaking of recovery, I'll now talk about the recovery period at home after colic surgery. Again, the average hospital stay is around 5 to 7 days, but the horse will need to be on stall rest for a full month after surgery. While the skin over the colic incision may be healed and the incision may look totally normal by 2 weeks after surgery, it actually takes the body wall 2 months to heal. It is also important for your veterinarian to recheck the incision before increasing the horse's turnout to make sure that there are no complications. After a month of stall rest and a green light from a veterinarian, the horse should then be allowed out in a small paddock for another 4 weeks. After that, they can move to a larger paddock for another month. 3 months after surgery, most horses can return to full turnout and gradually return to work under saddle. If the horse had complications relating to their incision, like an infection, this program may be slowed down to give the body extra time to heal. This is a reason that it is so important that you maintain a close relationship with your veterinarian so that any changes to this plan can be made if needed. In addition, it's important that you monitor your horse closely once they are home, including taking their temperature twice daily and paying close attention to how much they are eating, drinking, urinating, and defecating daily, so that any problems can be caught early and discussed with your veterinarian. Even with careful monitoring and care at home, horses can also have complications related to colic surgery after they've gone home. They can have repeated colic episodes, which should be evaluated by a veterinarian. Additionally, some incisional complications, like infection or a hernia, may not present until weeks or even a couple months after surgery. A picture of an incisional infection is on the right of the screen. If there is drainage of any kind from a colic incision, a veterinarian should evaluate it. An ultrasound may be performed to evaluate the integrity of the body wall or the skin incision may be open to allow drainage. The horse on the left of the slide is wearing a CM hernia belt. This is a product that can be used post-operatively if the horse has had an incisional complication. The belt applies pressure to the incision with the goal to prevent or minimize hernia formation. If your horse has an incisional complication, it is possible that this product will be recommended to you and it can be used at home. If a horse does not have any incisional complications, we recommend a gradual return to exercise starting 3 months after surgery. Horses usually lose weight, muscle, and top line while recovering from colic surgery, so it's important to start slow and give your horse time to build strength and fitness back as they return to work. Workload should slowly increase over several weeks. No galloping or jumping is recommended until 4 months after surgery, and the horse should have ample time to gain fitness before they are put back into high speed or high intensity work. While we cannot prevent muscle loss while a horse is on stall rest, like recovering from colic surgery, there are exercises you can perform to help build back your horse's top line and core after surgery. These exercises should only be started a month after surgery and with the approval of your veterinarian. I will discuss some of the more common core strengthening exercises briefly. Belly lifts are performed by applying upward pressure to the horse's sternum to encourage them to lift their back. And a picture of this exercise is on the screen. Tail tucks are performed by scratching the horse on either side of the dock of the tail so that they tuck their pelvis underneath themselves, engaging their abdominal muscles. And carrot stretches are performed by using a carrot or treat to encourage the horse to stretch its nose around to its hip and bend down between its legs. This exercise also helps to improve balance and flexibility. Generally, these exercises are performed a few days a week and are started with a low number of repetitions that are slowly increased with time. Your veterinarian can also help develop a personalized plan for your horse. While these exercises will not prevent your horse from losing muscle after colic surgery, they can help the horse gain back strength as they recover. The goal of many horses after colic surgery is to return to their previous job and previous level of performance. There are a few scientific studies published that have looked at this data, and one study found that between 75 and 85% of horses return to their intended job after colic surgery. Another study found that 55% of horses are at or above their preoperative level of performance within only 6 months of colic surgery. While there are no guarantees, there's actually pretty good odds that a horse will return to performance after colic surgery, and they'll likely be back to work within the year. Many owners also wonder if older horses can recover from colic surgery. Again, there is some scientific literature published comparing the outcomes of geriatric versus adult horses undergoing colic surgery. And these studies have found that geriatric horses actually have similar outcomes to adult horses and do just as well after colic surgery. Older horses are more likely to have certain kinds of colic, namely strangulating lipomas, those fatty tumors on stalks that wrap around a piece of intestine. And some older horses also have other medical concerns like PPID or lameness that may play a role in deciding to take a geriatric horse to colic surgery. Additionally, they are closer to the end of their natural lifespan, even with the best veterinary care and husbandry available. However, we have no evidence that geriatric or older horses have any worse outcomes after colic surgery than younger horses do, and age itself is not a predictor of the success of colic surgery. I'll also touch briefly on colic in donkeys. Donkeys tend to be very stoic creatures, and it can be more difficult to tell why they are in pain or colicky compared to a horse. Due to this, colic surgery is sometimes delayed as donkeys may not show any obvious signs of pain. Based on the scientific literature currently available, donkeys have lower survival rates than horses, and they are also more likely to have complications after surgery. If you have concerns that your donkey is colicky or in pain, they should be evaluated by a veterinarian right away, as they can sometimes be much more sick than they act. And while many horses experience complications following colic surgery, they're often not life-threatening. Here at the University of Minnesota, in the past year, we've performed colic surgery on 45 horses. 35% of those horses were euthanized during surgery for a variety of reasons that include owner constraints or prognosis for recovery for the type of cause of colic found. 2% of horses had an anesthetic-related mortality, and 63% of horses recovered from surgery. Of those 63% that recovered, 90% survived to discharge. 2 horses were taken back to a second surgery and were euthanized, and another horse was euthanized in the early postoperative period. But the University of Minnesota survival rate is slightly higher than the published short-term survival rate for horses that recover from colic surgery, which is around 83 to 87%, depending on the study you read. As you can see from this data, most horses that undergo colic surgery do make it through the post-op period and are able to return home to their owners. Now that we have talked about colic surgery and recovery in all kinds of equines, I'll briefly discuss an ongoing clinical research project here at the Leatherdale Equine Center at the University of Minnesota. As I mentioned earlier in the presentation, the most common complication after colic surgery is another colic episode. Our goal with this research project is to better understand which horses that experience this post-operative complication can be managed medically versus which horses will require a second surgery to recover. We are analyzing inflammatory markers in abdominal fluid and blood to look for trends in this data. I'll briefly describe our study methods next. We are collecting abdominal fluid using the same abdominocentesis technique that veterinarians use during a colic exam that we discussed back at the beginning of the presentation, both before and at 3 time points after colic surgery. We are also collecting blood at those time points. We are then analyzing the abdominal fluid and blood for multiple different inflammatory markers. Some of these markers can even be analyzed stall side, like the lactate meter that is pictured on the slide. Our hope is that these stall-side diagnostic tests will be available and relevant to a wide variety of veterinarians, not just those of us that work at a university. We are currently collecting data for this project, and to date have data from 10 horses completed, with our goal being to enroll 30 horses in total. So we're actually 1/3 of the way done. And thank you to those of you who have already enrolled your horses in our study. We really appreciate your consent and help. And we hope that if any of you find yourselves in the event that your horse needs colic surgery in the future, you would consider enrolling your horse. The information gained from this study will help us as veterinarians improve patient outcomes following colic surgery, and the results will be presented at a national conference and will be published after completion of the project. In the meantime, we will continue working to find better ways to treat horses with colic and how to make their recovery as smooth as possible. And with that, I will move on to the question and answer portion of the evening. And thank you everyone so much for your time and attention.
Great. Thank you, Dr. Granello. That was a wonderful presentation. Now we'll begin the Q&A with some of the pre-submitted questions that people from the audience submitted during registration. So we'll jump in. Okay, the first question we have is, are there any breeds more susceptible to colic than others?
So unfortunately, all horses are susceptible to colic. There are some breeds that are predisposed to certain types of colic, like miniature horses tend to get are more likely to get what's called an enterolith. But no, there's no one breed that's more susceptible to colic overall. Unfortunately, no great way to avoid it.
Okay, the next question is, when is a horse a good or a bad candidate for surgery? And sort of part two, at what age would you consider too old for colic surgery?
Yeah, kind of like I mentioned, older horses do just as well after colic surgery as and younger horses. And what could make a horse a better or worse candidate if they have other health concerns or ongoing health problems. And we do our best as veterinarians to work with the owners to decide what is the best decision for their horse and if surgery is the right option for them.
Great. Next, we have, would you advise to the current range of cost for colic surgery today?
Sure. I can speak to the costs at the University of Minnesota. And for an uncomplicated colic surgery, including the surgery, the stay afterwards at the hospital, the medications and everything is usually between ten and $12,000. And sometimes if we do a resection where we take out a piece of intestine, is looking more at the 12 to $15,000. And again, that's kind of the out the door price after everything is said and done.
Great. And I'll also just add for those curious about financial aid options at our website, vmc.umn.edu, under the For Clients tab, there's information about our financial aid options available. The next question we have here is, do the different causes of colic affect the duration of recovery in those different cases, assuming there's surgery without complications?
Yeah, so for all of those different types of colic surgeries that I discussed, assuming they don't have complications, they tend to have pretty similar recoveries, especially getting more out into the long term of it's still usually that 3 months back to some kind like light work and then heavier work at 4 months, regardless of the initial cause.
Great, thanks. Next we have, is it common for horses to pass away from colic without surgery?
So it certainly absolutely can happen. Colic is unfortunately one of the most common causes of death in horses because horses that have these surgical lesions, so those problems that won't be fixed without surgery, unfortunately, the only other option is euthanasia or the horse will pass away on its own.
Great. The last question it looks like we have here, we do have time for more if others are looking to submit some in the Q&A. But the last question we have is, what are ways to prevent some of the common causes of colic?
Yeah, that's a great question. I wish we had better ways to prevent colic than we do. But some things that can be helpful to prevent certain types of colic include making sure your horse always has access to fresh, clean water. And for those of us up here in the north, making sure they have warm water at least a couple times a day. Make any changes in your horse's feeding program slowly over about a week and introduce any feeds slowly over that amount of time. We recommend that a veterinarian evaluate your horse's teeth and perform any needed dental floating or work every 6 months. And we also recommend that you work with your veterinarian on a deworming protocol for your horse to help prevent colic related to those causes.
Great. We have one more as well. Is there a difference between a gas colic and maybe a more serious colic? If there is a difference, what can horse owners do to aid the animal if it's a gas colic?
Yeah, that's a great question. It can be really hard to tell sometimes, as gas colic can be very painful for horses, just like other kinds of colic. The good news is that gas colic usually can resolve without surgery or with just some medical therapy, but I'd still recommend that you call and talk to your veterinarian if your horse is experiencing a colic episode, and they'll best be able to help you with that.
Great. Looks like we do have a couple more. Is there
Great.
any specific age where colic surgery should not be considered?
There really isn't. Again, looking at the data we have available, that old horses or older horses can do just as well as younger horses. And I've done colic surgery on horses in their late 20s or 30s that do great afterwards. So it's really, really horse dependent, but there's not a cutoff where, we think they're too old.
All right. Then we have one here. What's the percentage of horses that break their legs or have another trauma while in post-op?
Yeah, that's a great question. And those numbers of horses that have a really big problem and in after recovery from anesthesia, that's usually around that, 2 to 4% of horses, looking at kind of some big worldwide studies. So it's not very common, but it's unfortunately a risk and that can occur.